All right, well, thank you everybody who is on this webinar. We're going to be discussing some guidelines and answering questions regarding COVID-19 and back to school topics. So I'm Jill Weatherhead. I'm a physician scientist at Baylor College of Medicine in infectious diseases and tropical medicine. I'm going to give the brief background on COVID and what types of preparations can be done by schools. And if you have additional questions, we can go into more detail. I don't have any financial disclosures. So coronaviruses are enveloped, non-segmented, single-stranded, positive sense RNA viruses, and they are not new. We know quite a bit about coronaviruses as a group in general, particularly because there are 4 endemic coronaviruses that occur every year causing the common cold or upper respiratory tract infection. These viruses are seasonal, so we do see them each year. However, more recently, we've been seeing the emergence of novel coronaviruses, particularly SARS-CoV-1, which came about in the early 2000s, 2002, 2003, and more recently MERS-CoV, which emerged in the year 2012. More recently, as we're all familiar with, is the emergence of SARS-CoV-2, which is the novel virus that causes the disease COVID-19. And this first appeared in a region in China in December of 2019 and has since, as we're all living, has led to a global pandemic. To date in the United States, we have over 5 million cases. And when we look at the age distribution of these cases, according to the CDC website, you can see that particular age groups, specifically young adults 18 to 29, as well as older individuals 50 to 64, have the greatest prevalence of disease. So they're more likely to harbor infection than other age groups, particularly compared to children less than 18 years old. But when you look at mortality rates, particularly as people age, the mortality rate actually increases with each decade, where getting up over 85 is associated with 32.1% risk of mortality. So while younger age groups, particularly young adults, harbor the most disease, they're much less likely to have severe disease and mortality compared to the older age groups. When we look at our data from Harris County in the Houston area, and this information is all readily available to everyone here on the Harris County dashboard, what you can see is we have nearly 100,000 cases in the area, 25,000 active cases, 1,200 deaths. But similar to the CDC data, we see that that young adult cohort, the 20 to 29-year-old age group, are also the highest burden or the highest number of individuals that have had COVID-19 in our area. And this is likely multifactorial, meaning that younger age kids may be in that essential workforce, as well as behavioral attributes, particularly early in the disease course where we were discussing lower incidence and lower complications of disease within this age group, which has shifted quite a bit. When we think about this disease, it's actually been quite an evolution in our knowledge throughout the past 7 to 8 months of its emergence. And so early on, what we knew based on other respiratory viruses, specifically other coronaviruses, is the mode of transmission most likely coming from respiratory droplet transmission. So what this means is in respiratory droplets that are released from your mouth, either through talking or singing or coughing or sneezing, these droplets are larger. So larger means greater than 5 micrometers in diameter. With these larger molecules, they settle fairly quickly in the air. They don't travel very far and they don't suspend for a prolonged period of time. So that means if the virus is attached to those respiratory droplets, in order to become infected, you need to be in close contact with an individual who has the infection, typically less than 2 meters or 6 feet is the definition we usually use for that direct inhalation. We also know that it can occur through what's called fomite or contact, meaning those droplets contaminate a surface and then an individual either touches that surface and then touches their face either their eyes, nose, or mouth, or they touch another object and self-contaminate themselves as well. More data recently has shown that potentially airborne transmission could be occurring as well. We certainly know that in certain medical procedures under certain conditions, these droplets can actually be smaller, so less than 5 micrometers in diameter. And when they're smaller, they can stay suspended in the air for a longer period of time, and they can travel for a little bit longer distance. This is called airborne transmission, and there's some data suggesting this is a possible mode of transmission on regular day-to-day life, but certainly in certain circumstances, particularly during particular medical procedures, this is another common mode of transmission. The current median time or median incubation time from exposure to symptoms ranges from 4 to 5 days, but as we've seen in the literature and as we've talked about throughout the course of this pandemic, is that you can display symptoms anywhere between 2 to 14 days post-exposure. So that's where that 14 days time period has emerged from. The disease is quite interesting in that you can have asymptomatic, pre-symptomatic, or symptomatic disease and potential viral transmission. In a recent study in the United States through the CDC, surveying multiple areas throughout the country, it was found that 15.6% of all those who tested positive throughout all ages were actually asymptomatic. So this has brought up quite a bit of concern that if you're asymptomatic, you don't know you're infected, how are you preventing yourself from infecting other individuals? Well, one piece of information that we still don't have clear information on is if an asymptomatic patient can actually transmit this virus. We do know that pre-symptomatic patients can transmit the virus, and what pre-symptomatic means is when you get tested, you have no symptoms at the current time, but within the next typically 4 to 5 days after your negative test, you'd start to develop symptoms. And we know that during that pre-symptomatic phase, a patient is infectious at least 1 to 3 days prior to symptom onset, and it actually can contribute quite significantly to the secondary attack rate, which is how likely individual will spread the disease to other people. So as you can see from this particular data here, the secondary attack rate from a pre-symptomatic individual, so someone who doesn't have symptoms yet, is about 3.3%. But if you're in close contact with somebody, particularly if you're living with an individual, that rate goes way up. And again, that's because of that needed close contact through most likely the droplet transmission. So this is very concerning information, and this is what transpired the new regulations and recommendations to wear masks for all individuals, not just those who are displaying symptoms, because of this risk of having the virus, being unsure that you have the virus, but being able to transmit virus before you display any symptomatology. Of course, we know that you can certainly have symptomatic disease, but that spectrum of symptoms can vary significantly. Often when we were hearing about this early on, you heard about the triad of fever, cough, and shortness of breath, and this is certainly true, but more commonly seen in those who progress to more severe disease requiring hospitalization. Those with more mild to moderate disease can have a spectrum of symptoms, including the new loss of taste or smell, changes to the skin, termed covetose or acrodermatitis, as well as gastrointestinal symptoms as well. So there's quite a bit of spectrum with these diseases, which makes it very difficult to isolate this particular infection, this particular virus from other viral infections. And early data from the CDC Chinese surveillance studies found that about 81% of adults had mild to moderate disease, but nearly 19% went on to develop severe and critical disease with a case fatality rate of over 2.3%. Now, in comparison to that adult data, which varies based on your region, of course, children are much more likely to have either asymptomatic, mild, or moderate disease. And again, will display some of the very similar symptoms as an adult, but more commonly or less commonly will progress to that severe disease state requiring hospitalizations. Now, that being said, anyone who has underlying risk factors as defined by the CDC for development of severe disease can certainly progress regardless of age. So according to the CDC, indicators of increased risk of progression from mild and moderate disease to a severe disease include the elderly or persons greater than 65 years old, persons with underlying cancer, chronic kidney disease, underlying chronic lung disease, solid organ transplant, cardiovascular disease, sickle cell disease, and type 2 diabetes. In children, particularly young children, obesity as well as lung disease and prematurity are also potential risk factors for development of severe disease found in recent studies. However, more recently, the CDC has isolated additional potential risk factors, and you can see there's quite a bit more of the common diseases that we typically see, including asthma, high blood pressure or hypertension, dementia, pregnancy, underlying smoking. So this starts to include a lot more people in terms of who could potentially progress to more severe disease. And this is important to know these underlying risk factors as we start talking about children and teachers and staff going back to school. As we know, closer contact, more people communicating together or grouping together will lead to increased disease, and you want to be able to protect those with underlying conditions. So when we think about teachers and staff, in a recent analysis, it showed that 1.5 million teachers, which is 1 in 4, have one of these underlying risk factors that could lead to serious illness. So it's important that we're talking about protecting the children, but also protecting the teachers and staff as well as the greater community. So in summary of COVID in general, what we know is that asymptomatic disease is common, but the transmissibility is unknown, and it's particularly common in children. Pre-symptomatic disease is a major threat. It's responsible for large clusters of outbreaks, particularly with large group gatherings, and needs to be considered in terms of transmission mitigation. There's a wide range of symptoms associated with COVID-19, and progression to severe disease has been linked to underlying risk factors, and children are susceptible to infection. They can carry high viral loads, but generally have more mild disease compared to adults. So what does this all mean for schools? The real question is that we need to weigh both risks and benefits in order to make educated, scientifically based decisions regarding our school system. So first, understanding what the risks are in terms of having kids, teachers, and staff back in school. So the first most obvious risk being it puts individuals at risk of getting infected. Again, as you get more people congregated together, particularly in indoor spaces where they're in closer contact, there's a risk of viral transmission. And what we need to think about this is in the context of further community viral transmission. So anytime you have a group of individuals and there's viral transmission, it's then putting the community at risk and perpetuating the transmission within the community. So it has to be thought about in the context of the greater community good as well. And it also needs to be thought of in terms of what do we do if individuals do become sick. So in this particular case, in comparison to something like influenza, we don't have preventative medications, we don't currently have a vaccine, and there's currently no cure for this infection. However, there's several benefits that we're all well aware of, particularly with the importance of academic instruction, but going beyond that, going beyond identifying individuals who need more instruction, who need more assistance that need to be paid in person, there's also social and emotional skills that are developed during school. There's the access to reliable nutrition, as well as physical and speech therapy, as well as mental health, and then introduction of physical activity at school systems as well. And so because of this, the AAP, or the American Academy of Pediatrics, strongly advocates for the goal of having students physically present in school. And they recommend this, though, in the context of having structure in which you can adjust protocols, adjust policies based on new and emerging scientific evidence, as well as with particular metrics that are set up by the school systems to understand if there is increasing transmission within the schools and within the community. So advocating for in-school if these measures are able to be installed within the community. So how do we reduce the risk in order to benefit from kids being in school? So the biggest thing at this point, and particularly where we are in Houston, is controlling community transmission. So whenever there is high ongoing uncontrolled community transmission, schools are going to reflect what's happening in the community. So there will certainly be outbreaks. So community transmission must be controlled. And we are really fortunate to have leadership in the Texas Medical Center that have given us metrics to meet to understand what community transmission really is. So this is part of the Texas Medical Center dashboard, which is again readily available for everybody. And they're looking at 3 different indicators. The first being effective reproductive rate, which the number that we're trying to hit is less than 1. So this is a measurement of how effective our collective measurements, such as mask wearing and social distancing, have been in controlling community transmission. So as you can see here, right now we're at 0.89, which is great. So that means reduced viral transmission within the community, and we want to be there for less than 14 days. And at this point, we've been at that benchmark for less than 15 days. So that's really great news. In terms of daily new cases, this is the second metric. Yesterday, we were up towards 1,500. Now today, or as of August 24th, at 838. So that's also is quite good in terms of reducing the number of daily new cases. However, for community control, we need to have less than 200 cases for over 14 days. And that 200 case benchmark is based on the availability of contact tracing to be effective in finding and quarantining, isolating new cases and quarantining contacts. And then the last measurement is test positivity rate. So how many tests out of the total testing population turned positive. So back in what was our peak in June and July, we reached up to 26% in the Texas Medical Center. We're now down to 7.5. And if you look at different metrics around the city, we're somewhere between 7 and 10% in most areas. And for community control, that metric is less than 5% for 14 days. So certainly headed in the right direction, which is really great news, but additional work to be done to really have community transmission here within the Houston-Harris County area. The second mitigation strategy, which we've heard a lot of, is physical distancing. So we know that physical distancing reduces the risk of viral transmission. There are studies suggesting any time that you increase over 1 meter, that risk of transmission goes down significantly. The last piece of mitigation strategy is wearing facial coverings. So we again know that wearing a face mask will reduce the risk of viral transmission significantly. The questions are, though, how that will affect this is how people are putting them on, how are they taking them off, and how are they storing them. So here are a few examples from the CDC on how to put it on. So you want to make sure that you're touching from the ear straps around your ears, and that the fabric goes up above your nose and down below your chin. And when you're taking off or doffing the mask, that you're again taking it from the ear loops and not touching either the inside or the front of the facial covering. Most people should be able to wear a mask. Those who are under the age of 2 and those who physically cannot put on or take off a mask without assistance are groups that it would be harmful to wear a mask in those situations. So briefly, I just want to run through some of the recommendations from the American Academy of Pediatrics that highlighted different strategies for different age groups, so age stratified approaches. So for the pre-K age group, where the relative impact of physical distancing is likely to be small, and it's going to be difficult to implement. It's going to be difficult to get these younger children to keep masks on, to not switch masks between each other. So those are going to be lower priority strategies for this age group. Cohorting classes, meaning minimizing any crossover between children and adults within the school, as well as utilizing outdoor spaces as much as possible, are going to be strategies that will have a higher impact with this age group. With elementary students, again, if they can wear face coverings, if you can keep them 6 feet apart, particularly with their desks, Cohort classes and use of outdoor space, again, is going to be the best approach for this age group. And then lastly, for the secondary school, which is your middle and high school, universal face coverings, avoidance of any close physical proximity, physical distancing, and cohorting, again, are going to be important. And there's some strategies listed here in terms of how you cohort secondary schools. And this is particularly important as more data has emerged suggesting that children over the age of 10 are capable of transmitting the virus similar to adult populations. So this is an important age group to really target. And then of course our college age students, where college campuses are community living spaces, they're shared resources, cafeterias, libraries, sitting rooms, and even within dorms, fraternities, sororities, and large housing. So these are areas where viral transmission is going to be higher, and we've seen that in these preceding weeks. If you look at, for example, University of North Carolina that had multiple outbreaks within the first week of reopening. So these are hotspots where viral transmission and outbreaks are going to be more likely. So in summary, from transmission dynamics, that we need to be monitoring cases within our community closely in order to have successful school openings, and implement age-appropriate mitigation strategies, including universal face coverings, physical distancing, cohorting of classes, outdoor space use, and frequent disinfecting hand hygiene efforts. With that, I will pass it on.
Thank you so much, Jill. I really appreciate it. As a parent who's getting ready to send her kid off to school, I'm also grappling with all this information, and so it's always good to hear it. So I'm Dr. Laurel Williams. I'm here at Baylor College of Medicine in our Department of Psychiatry. As I said, I'm also a parent thinking about what's going to happen for my young person. And so today I'm going to spend a few minutes talking to you about what to do from an emotional perspective to help your children during this time frame, and help yourself, frankly, help the family. I have no disclosures other than to say we're all in this together, and you can use any of these images as you like, but I think 2020 has definitely been a very trying time. Many of you have already tried to do classes remotely, and we all know that there's going to be some elements of potentially being at home doing virtual learning as well as being on campus. So there's going to be a lot of work that families are going to be needing to do on top of all the other things. So if you feel like you've aged 20 years in 6 months, I feel your pain just as well. And so little baby Yoda is definitely old baby Yoda now. So I said there's 7 steps in my talk. I kind of fibbed. There's really 8. And so the first one I actually really want to talk about is take a deep breath. Breathing, so important. And this sort of idea that there's going to be the one right way to do something on some level as a mental health provider, I want you to know that doing your best is really what we're talking about here, and doing your best and also getting help and support. So don't feel overwhelmed. If you're feeling overwhelmed, take that moment to yourself to kind of recollect, connect with things that will help you, and then kind of get back at it. So information today is really meant to be additive, things for you to think about, not that I'm saying you must do these things. And it's not easy being green. So one of my favorite childhood stars is Kermit the Frog. So all the work we're doing right now, it's not easy. So in sort of teeing that up, this very first step, I really want everybody to really focus in. And honestly, if you listen to nothing else I say in the next few minutes, this one is really key. Parents, caregivers, family members, it really is about controlling your own anxiety. Children are sponges. Even if you have thought to yourself, I'm not talking in front of the kids about this, they don't know, they know. And so the more that you are feeling anxious and overwhelmed with this COVID situation and going back to school, what you're doing, the more that is going to be transmitted. And so this is not a shake your finger issue. It's more of, yes, you need help too, not just that your child needs help, but that as a family, we all need to help each other. So separate from COVID, we just know from data and science that anxiety is infectious, but also good moods are infectious. So as you say, I see the slide up here at the picture at the top, careful mom, I might just catch your good mood. So we want to have this idea that we can have positivity without being Pollyanna-ish, and that will go a long way to helping your child. So when you need support, think about going to trusted information, like what just Dr. Weatherhead told you, like she's a trusted source of information about COVID. You know, resist the urge to look at Facebook all the time. It does not have correct information in it. Go to sources that are trusted, the CDC, your own family physician, organizations like Baylor. Those are the places to go to actually ask for the accurate information that you need. And then when you are feeling overwhelmed, talk to other adults in your life, whether it's your spouse, other family members, friends, to get support so that you can be there to support your kids. Catch your good mood. Step 2 in helping your child weather this developmental challenge with COVID in school, don't assume. Now, we all know what assume means, and I thought of a couple of funny pictures to put up, but then I decided it might be in poor taste. But you all know what the acronym, the statement is about. What does assume actually happen? I see Jill laughing, so somebody's catching my drift. So one of the things that adults do all the time is they assume, because they know their kids, that they know what their kids are thinking. So then they go on this assumption that they know, and they start talking, which actually leads to oversharing, particularly at maybe not a developmentally appropriate level, and that actually can raise a child's anxiety. So one of the things that I honestly say to families all the time, separate from COVID, is just ask. You will be probably occasionally surprised by what they're actually concerned about, and maybe the thing you're thinking is the biggest thing to be worried about. That's not what they're worried about at all. So first, ask what they know, what they've heard, where they've heard it from, and then based on that, you can start to respond to those questions. And what I'd like to say is developmentally, the younger the child is, the more you really stick to the question being asked and you don't expand. As you get into latency age, kids are better able to handle some more future-oriented ideas. And obviously, by the time somebody's an adolescent, they can start to think about problems a little more complexly. So you can certainly help a child a lot with managing their emotions by first just asking what they're thinking, what's on their mind, and then that will really help tee up what you need to do next, okay? And that is step 4, validate their feelings. Now, a lot of families that come to me for help get a little frustrated with me sometimes because validation is not the same thing as agreeing. I don't have to agree with somebody's emotion, and I don't have to agree with maybe their behavior related to that emotion. But I'm not going to get anywhere with helping them if I don't first validate how they're feeling. And so this is why I like to use the story of Inside Out and Bing Bong. If you've not seen Inside Out yet, it's a child psychiatrist's dream for everybody to learn this. But there's a point in the story where Bing Bong, the character, is crying and very upset. And Joy comes around and tries to make him happy. And the more that Joy tries to make him happy, the sadder he gets. Because what's happening is Joy is not validating the fact that Bing Bong is really sad. So what happens is actually sadness comes in and empathizes and says, gee, that seems really hard. I see why you're sad. Then he feels connected to the other team member or the character, and he starts to get over his sad feeling, and then they can move on. So until you really stick with the validation of how they're feeling, you're not going to help them learn new information and maybe change how they feel. Parents often want to go to just fixing the problem, and that is missing the step of validate. So in this time of stress and uncertainty, remember to connect emotionally and validate how they're feeling. But again, I'm also very clear, validation does not mean agreement. You're not saying I agree with how you feel. You're just saying I think I understand, or tell me more so I can understand how you're feeling. Number 5, remember step 1? Okay, so no, not flexibility. The one where kids are sponges. Model what you would like your child to be doing as they're managing the complexities of being online and learning how to do their math homework in an app that whichever school system is asking them to do, and they're frustrated. How do you want to model for them how they manage that frustration? So again, children are sponges, and if you are modeling that it's something that's impossible, it's hard to do, and you're very frustrated, then that's how they're going to see how to do things as well. So it's not that I'm not saying don't get frustrated, because trust me, I've been there. I've got a kid and they're getting ready to start online school, I think. But how you help them navigate that frustration and how are you modeling navigating that frustration will really help you guys be a team and work on getting through it so that they can have a good educational experience, depending on whether or not you're doing it completely from home or end up doing a hybrid or going back to school. Step number 6, one of my favorite other characters is from Winnie the Pooh. And this sort of idea of when we talk about trauma work, finish the story. So many times when people get stuck after a terrible life event, and COVID has definitely, for many people in the world, in Texas, in Houston, has had devastating effects. It's definitely not to minimize those devastating effects, but if what you do is just always keep talking about the negative of that situation, you're not helping a child learn resiliency. So resiliency is not that you never have problems in your life or bad things don't happen to you. It's how do you end that story? How do you sort of say, yes, this happened, and yes, validate the feeling. That is sad. I agree with you. But then you have to help the young person pivot to what could be the next step. So you have to have that balance between validation versus just sticking with only the thing that was bad that happened. So this idea of building resiliency in a time of uncertainty is a very important thing to be thinking about. So again, life is not about how fast you run or how high you climb, but how well you bounce, okay? And then finally, I'm a Star Wars sort of nut, and if you see the background, I actually have a bunch of Chewbacca stuff in my background because he's my favorite character, but resist the dark side. So much of what's happening right now is about polarization, and that pulls people apart. So as much as possible, again, going back to the first step of modeling, and children are sponges, if you are constantly saying how, well, this is happening because of this, or this is that, or that person's so terrible, or why can't the school do this right? I can't believe they can't get this done. You're teaching your child to sort of not be problem solvers and just make these assumptions that other people are the reason for their problems. And that can lead to bad stereotyping and sort of additional bad things down the road. So yes, there are problems, and yes, we want to solve them, but resist when you can this idea of blaming other people, institutions necessarily, and really thinking about, okay, well, this is a problem, and yes, this person's involved or this organization is involved, but I don't think that everybody wakes up every day trying to make my day bad. So back to that idea of you sort of modeling how you want to manage will really help your child get through this and not feel so insecure. So what do you do if you think that, yes, you're managing it, but now you are a bit worried about your child's mental health and you think that you might need a professional? Well, the first thing I would say, it's okay to say, it's okay to ask. So if you are concerned, you know your child better than anybody else. So if you are concerned, please reach out to your primary care physician and say, I'm worried about my child. I think that this is more than just anxiety that's normal, and I would like to see if I need some help. Well, luckily, there's a new state program that's funded that's called the Child Psychiatry Access Network. It's across the state of Texas. Baylor has a hub that's for this area. And what will happen is your primary care doctor can call and speak to a consultant who, while you're in the appointment with your primary care doctor, can help your primary care doctor think about next steps. So it's a really nice way for you to get some other team members to be involved with your PCP before you even make the step of making a referral. So I would really encourage you to talk to your PCP as a first step if you're worried. The second new program that's actually happened that Baylor's participating in, it's again statewide, is called T-Chat, Texas Child Health Care Access Through Telehealth. And Baylor is going to be participating with several school districts in the area, and UT Houston will be as well. This is a free service. So if your child gets a referral from one of these schools and you would like to be seen by a child psychiatrist or a therapist, this will be provided to your family in your home for free for up to 4 visits. And then our team will help you find a longer-term treatment if that's what's needed for your child. Beyond those 2 services, there are a number of other services, but because of the brevity of this conversation, I really want you to focus on if you have a primary care doctor, reach out to them. They can help you think through. And if they need help, they can call CPAN, and together we'll get through this storm. And together, speaking of storms because of the hurricane, but together we'll get through this. And I really want us to be stronger together, as we like to talk about in Houston. So thank you.
Thank you for that, Dr. Williams. I'm going to go ahead and share my slides here. Okay. Good evening. My name is Dr. Irvin Salapis, and I am a primary care sports medicine physician at Baylor. And I'm going to talk about getting back into sports in the world of COVID. You know, not all of us have relatives, family members, children in the professional leagues right now, where, you know, the Major League Baseball's back, soccer is back, the NBA lives in a bubble, NFL's going to start soon, hockey playoffs are going on. So sports, in a sense, is back, but, you know, the big question is how do we return that back in the school age population? And I'm not talking about just like football, basketball, cross country, but this includes marching band, cheerleading, dance team as well. So high school fall sports is back. In Texas, the governing body for public schools is UIL, otherwise known as the University Interscholastic League. The season started actually, or practice started for 4A schools and below earlier this month, but their football season technically starts this Friday, or this Thursday or Friday. With the bigger high schools, classes 5A and 6A, they're going to begin practice after Labor Day, and then the season for volleyball, cross country, and football will start at the end of September. So with that, the season will go up until like the first week of December, with possible state championships in January. So it just got pushed by a month. For the private schools, the TAPS, the Texas Association of Private and Parochial Schools, they're following a similar structure, but practices are starting after Labor Day as well. And there's another conference in Houston called the Southwest Preparatory Conference. This is Kincaid, St. John's, Episcopal. They've technically have canceled the fall 2020 season. However, those schools are actually going to, some of the schools are actually going to play as independent teams and creating a schedule soon. So risk of spread in sports. The National Federation of High Schools kind of put sports into 3 categories in terms of risk of COVID spread. In the green is the low risk sports, golf, tennis. Tennis is moderate risk sport, but golf, swimming, cross country, bowling, bicycling. Moderate risk sports are the other ball sports, you know, basketball, volleyball, soccer, baseball, tennis. With high risk sports, that's more with, that involves a lot more contact, like football, wrestling, martial arts, cheer and dance, and also field hockey. So considerations on what to do to help mitigate the spread is also determined in the sport. A good example is with the cross country season, which is starting in this fall. The consideration is doing staggered start times. So you're not having everyone start at the same time. So the protocol for athletes and staff for COVID-19 screening. Schools should have, depending on the school district and or the private school, there should be a regular symptom screening checklist daily. Anyone who tests positive for COVID-19 or having symptoms must stay at home. And in order to return back, to return to school or sports, 3 criteria should be met. It's been 24 hours have passed since the recovery of the symptoms. There has been improvement of the symptoms, and at least 10 days have passed since the symptoms first appeared. For UIL rules, any athlete who tested positive for COVID-19 must be cleared by a physician before returning. This is kind of like the same rules when we have a kid with a concussion and needs a doctor's clearance to get back to play. So considerations from a post-COVID exposure, if a kid or athlete is positive, they should quarantine for 14 days. If the athlete is asymptomatic during those 14 days, we have seen, asymptomatic carriers of this virus, they can go back to a gradual return to play in their sport. So basically, if they're quarantined for 14 days, they should be shut down. No exercise, you just rest and try to recover, even if you're asymptomatic. The gradual return to play is basically just like, the first day, starting with a light jog, and day 2, you get a little bit more exertion. Day 3, maybe introduce a ball if you participate in a ball sport. Day 4, maybe do a little bit of contact. And day 5, if you're feeling good, then you go to a full return to play. So it's over the course of 4 to 5 days to do the gradual return to play. Now, if an athlete had symptoms of COVID and they have improved, like I mentioned before, they will still need a medical clearance from their doctor to return to their sport. With more moderate to severe cases, like what if the kid was hospitalized for COVID-19? There was a paper that came out back in June from the American College of Cardiology about considerations of returning back into sports. And they had a protocol that was recommending, besides getting a medical clearance, they should actually have a cardiac clearance as well, with an EKG, an echocardiogram, which is an ultrasound of the heart, and also doing some blood work like troponins to make sure that they don't have an inflammatory reaction into their heart muscles, which is known as myocarditis. Myocarditis is an absolute contraindication to play. So, we have to screen for that. I believe 20 to 22% of hospitalized patients with COVID, now this is more in the adult population, but 20 to 22% actually have cardiac complications from COVID. So the big question and consideration in coming in the sports world is cardiac clearance. All right, so what about attending sporting events? That really depends on the local health county ordinances. So Dr. Weatherhead mentioned that, our numbers are going down. We're still not out of the out of it yet, but it is trending down. So we'll see what the next couple of weeks will play out. The UIL is limiting spectators to 50% capacity max. Now that'll depend on the school district or the local school to see if they want to limit that even further down. Fans must wear masks and adhere to social distancing protocols. Maybe in terms of like school district stadiums, there may be e-ticketing to prevent or staggered entrances for fans to come in terms of concession stands, no open condiments next to right outside the concession stand, similar restaurant guidelines. And then for those who really want to watch high school football, as you guys know, high school football is a religion in Texas. For the first time, all high school football games will be telecasted for the season, whether if it's going to be live streaming on the internet or local television. But I would talk to your local high school and school district for their schedule. So, what's the place that has a concern for disease spread, even pre-COVID? The locker room, right? So, so locker room, the weight room, the gym, the basketball court. So all teams are required to wear a mask entering stadiums or their practice fields. And then they can, depending on their sport, they may or may not be, they may be able to take off the mask as long as they're practicing social distance guidelines. Every attendee must be screened appropriately before entering those premises, like I mentioned before. In terms of game situation, The host team will be responsible for properly cleaning and disinfecting all locker rooms, and also the loading and unloading zones for their gym equipment or their sporting equipment. Okay. All right. That's all I have for my bit on this presentation. So I believe, Katie, I think we're now open to questions.
Yeah, so if anyone has any questions, I know I've seen some folks drop some already in the chat, but if you have any other questions, feel free to drop them in the chat and we'll kind of go through some Q&A for the time we've got remaining. The first thing that I wanted to bring up as a point of discussion, I know we kind of chatted about it previously, but talking about our educators, what can and should our educators be doing in their classrooms once students are coming back in person to keep not only their students but also themselves safe? Are there any tips we can give to our teachers out there?
So I can start with that. Anytime you're in an indoor setting where there's multiple people there, the risk of transmission is going to be greater. So the same thing that applies to the students is going to apply to the teachers, educators, and staff. So particularly with adults where we know that transmission is going to be higher, so they're able to transmit the virus more readily, wearing a mask and keeping distance, frequent hand hygiene is very important. Other things though, like just reducing adult to adult interaction. So keeping just one teacher with that classroom, not having teachers go to the staff room where they're congregating, really reducing any sort of adult to adult interaction is going to be critical in those situations where there's ongoing viral transmission within the community. But the main steps are going to be distance and face masks to prevent any further transmission from the virus standpoint.
Awesome. We've seen this question a few times. Does the virus stay on surfaces? Do we need to change clothes when we're coming from home or when our kids are coming home from school?
I guess I can do that one as well. So we know from early on in the pandemic, there were quite a few studies trying to determine within a lab controlled environment how long the virus will stay viable. So you'll be able to test different surfaces and find viral particles through doing what's called PCR testing, which is just the genetic material. But what we want to know is the virus viable and can you then transmit it? So what some of the earlier studies found was that it can stay on different surfaces for a different period of time, with the longest period of time from most studies suggesting 72 hours on things like stainless steel and plastic. So in terms of wiping commonly touched surfaces down, those are the type of surfaces you really want to make sure you're disinfecting when there's a lot of people that are touching those surfaces. So lots of kids touching door handles, lots of kids and adults touching computer keyboards, those types of things need to be disinfected regularly. But when we're talking about clothing, the virus will most likely stay on it for a very short period of time. So when we're talking about healthcare providers, emergency crews that are having constant contact with infected individuals where the risk is really high, then it is recommended to change out of your clothes because that could be contaminated. But in lower transmission risk areas, it's really going to depend on your community. So if there's not a lot of transmission within your community and you're just going out into the grocery store or stopping by your kids are going to school, you don't necessarily have to change all your clothes before you walk in. So it's about what the activity is that you're doing and what your community transmission is. Now there's some of the sports, for example, where there's a lot more physical contact that Dr. Solapas can talk about a little bit more, where that might be a bigger threat. But really in schools, if there's lower transmission in the community and there's not a lot of physical contact, that risk is going to be much lower than, say, in hospital workers.
Great. Dr. Solapas, a question that came in. Would you consider gymnastics to be considered a low, medium, or high risk sport?
Good question. I would consider gymnastics as a medium risk sport. It is a team sport where the individual goes one at a time, right? So, so in terms of physical contact, there's not much in gymnastics. However, they do share the same apparatuses. So I believe even with USA Gymnastics, they're doing protocols to where like after an event, they are wiping down the equipment and waiting before they another athlete uses the event apparatus.
Great. Dr. Williams, I saw you responded here in the chat, but I think it's such a great question that I want to bring it up for everyone to hear. For our elementary age kids that are really looking for that social interaction, what can we recommend to parents for kids around that age? How can they maintain social distancing and make sure they're getting those social interactions that they need?
So I definitely would start with the Dr. Weatherhead's comment. I mean, the more community spread there is, the more likelihood that, just being in enclosed spaces or, being close proximity with people increases your risk. So what I do think is a reasonable strategy is that if you have some other friends or people that have similar age kids, that you have a very concrete conversation with them about what they're doing and be really on the table about it, and don't fib about what you're doing, and say, yeah, this is where we're going, this is our risk. Do we want to kind of be in a pod where we're all sharing, we're not really doing much other things, and we all agree that our kids can come, and maybe you go and do it outside when it's not boiling hot or in the middle of a hurricane. So I would definitely suggest as much as possible trying to do it outdoors, because that is then an outdoor capacity. But then if there's really, for whatever reason, it's not viable and you have to do it indoors, limit the number of kids so there's not too many kids, and then really agree that everybody's going to be consistent about your practicing of, hand washing, masking when you're out in public.
Awesome. And then we also received a similar question about our middle school students. They're doing a lot of online learning these days, spending a lot of time in front of the screen. So what could we maybe do to help their mental and social well-being for that age group?
I think that it's actually very context dependent. There's some kids that really love that all they're getting to be constantly on their devices, and usually we were trying to make them not be on their devices. And so now they're actually kind of happy as little clams because they're getting to constantly be doing Snapchat, Instagram, TikTok with their friends. I think that with that older crowd, they are better at wearing masks. So you could still have a smaller cohort, as long as everybody's real clear about what what families are doing, and then maybe you do have a couple of the kids that they could meet. Maybe they're indoors, they're practicing 6 feet apart and wearing a mask, but they could still see each other because they're going to be better at being able to keep a mask on properly and take it on and off properly.
Awesome. Dr. Salabas, we received a similar question for gymnastics, but around ballet and dance. I think I saw that was listed as a high risk sport. Can you elaborate on that?
Yes, dance is considered a high-risk sport, and it is practiced and performed indoors in circulated air in close contact with fellow dancers. However, you can lower the risk by splitting the class into two, maybe decreasing the number of students in the class, or using only one part of the room and making sure everyone is spread out with no contact or very minimal contact in regards to dance. So yes, it is high risk, but lowering the numbers of participants in a class can help bring that down. I saw a question on this good size small cohort. It really depends on the size of the room. If the room is basically, we should practice 6 feet social distancing. So if the room's big enough to have maybe 10 or 15 people max that can spread out 6 feet or maybe less. Some people have bigger areas, like a big, like a weightlifting room for high schools that may get 15 or 20, but it's really based on the dimensions of the size of the practice facility.
Awesome. Dr. Weatherhead, what do we consider the risk level kind of taking on Dr. Salopis' low, medium, high for kids eating lunch inside the classroom?
Right, so those measures have been implemented to actually reduce risk of viral transmission. So when you think about large schools specifically where there's a huge cafeteria and there's a lot of kids that are packed in, they all need to take their masks off to eat. So that's going to be a high risk event. So in order to reduce that, we recommend putting them back into their classrooms where it's cohorted. You can space the kids out a little bit more, and that risk goes significantly down because the interactions between the number of kids is less. So if you're able to space children out at least that 6 feet, when they take their masks off to eat, particularly in the classroom where they're cohorted, the risk is going to be much lower.
Awesome. And then we'll wrap up with this last question. If we didn't get to your question, feel free to still drop it in the chat and we can follow up with you guys after the webinar. But last question here, kind of overlapping with sports and overlapping with social interaction. What are y'all's thoughts around public pools? As we know, the heat tends to linger here a little bit longer in Houston. Can we be going to the pools these days?
I think so, but you still need to practice social distancing guidelines. If you're outside laying at the pool, make sure that you're staying 6 feet, apart. If you're trying to swim for exercise, stay in your lane. Go to a lap pool and try not to, accidentally bump into someone. So as long as we're doing safe measures, I think it's okay to swim.
I agree with that as well. So as long as you're able to keep the distance within in a pool or really any outdoor activity, then the risk will be much lower.
Awesome. Well, with that, I just want to thank our panelists for all this great information that y'all shared. Again, if we didn't get to your question, we have the question that you submitted, and we'll follow up with you guys after the webinar. So thanks so much, everyone. Appreciate your time.
Be well.